Liberia. Malaria cases dropped, HIV treatment neared global targets, and mental health services grew with new specialists, training, and the achievements of the Ministry of Health from January 2024 to August 2025 illustrate a sector in transition. Progress in infrastructure, workforce, financing, accountability, and disease control reflects a health system that is steadily recovering and moving towards resilience. Challenges, however, remain, particularly in maternal and child health and the sustainability of financing. But the foundations for long-term improvement have been firmly laid. Through both domestic reforms and international recognition, Liberia's health sector is now better positioned to meet the needs of its people and to respond to future health emergencies. May God bless the Ministry of Health, and may God bless the Republic of Liberia.
Thank you. Can we go to the slides now, please? Presentation, please. Tech group. Okay. Ministry of Health Diaspora Conference participation. I am not Dr. Poto. I'm going to try my best to speak for her. Next slide, please. So this is an outline, an overview. I'm going to talk about some of the health challenges, our key focus areas, some achievements, our future plans. So Liberia in the health system. Sorry, I'm not that tall. Thank you. Okay. So we're about 5.4 million people. There's 15 counties. We have about 98 health districts. In Liberia, we have three levels of care: primary, secondary, and tertiary. There are 921 functional health facilities right now, 84.9% health clinic, and 43 hospitals, which is about 44.7%. And then 29%, what's challenging here is 29% of our population without access to a health facility within 1 hour walk. So that is a challenge that Dr. Poto is trying to correct. So the performance, the health system performance. And if you are aware, Dr. Poto is a OBGYN. So women's care, women's health, and neonatal health care is a concern. And I know that that is also the First Lady's concern as well. Can you go back to that slide, please? Okay. So one of our challenges is we have a high maternal mortality rate. So for every 100,000 live births in Liberia, currently we have about 742 deaths. So, and as far as the newborn death rate, we have about 37 per 1,000 live births. So that's also a concern. We have a low health worker density. The World Health Organization recommends 23 health workers per 10,000. We have 13.9, so you can see the challenges we face. Still on that slide. I'll tell you when to go, I'm sorry. So also, some of our challenges are also low motivation of health staff. We're looking at remuneration in career growth. We have large numbers of volunteers. We did make some change. We did make some accomplishment here. We have about 501 nurses now on the CSA payroll. So that's a really great change. the infrastructure, including our equipment. So what the minister is trying to also do is, you can move on to the next slide as I'm speaking. Thank you. What she's also trying to do is to make sure that we have the right equipment available to our healthcare workers, so that when people come in for primary care, we can target and hopefully diagnose those diseases early, so that we're not looking at when people are extremely sick and trying to leave the country. And that's one of our challenges. People always leave the country for care. So we're hoping that getting in the right equipment, we can diagnose these diseases so that we can treat right away. So we have an we want to improve maternal and newborn child health services to decrease maternal mortality, decrease the newborn death, and decrease stunting, which I think the Ministry of Agriculture presentation also talked about, because the kids are malnourished, so that it stunts their growth rate. Also improving referral and linkages between primary and levels of care. Increase opportunity for career growth by all staff, irrespective of whether you're a nurse or a doctor. And digitize health records. There are some questions. We are having conversations about electronic health records. That is in the work right now. And we're also talking with key stakeholders. So increasing probability, accountability, and transparency. I have seen that from working with the minister. I'm very proud of what she's doing. Introducing the National Health Insurance for Liberians. Right now, that is in the work. Very excited about that, because I think that would benefit everyone, regardless of your income level as well. So we want to increase collaboration and joint planning with all stakeholders, our national partners as well. Next slide, please. So leadership and governance, I believe Minister Gafwan talked about the budget, so you can see that right there. I'm a nurse. I don't think I should be discussing the budget, but there's some figures right there, and this will be also available on the Ministry of Health website. You can also follow the Ministry of Health on Facebook as well. We revise our key policies. We focus on strengthening our priority areas. And I just talked about the health insurance scheme. And let's see, we can move on to the next slide. I'm going to jump over some slides because Dr. Dunn gave me a time limit. So I'm trying to stay within that time limit. Okay. What we've also done is making sure that the drug is stocked to the last mile. So we piloted the community health pharmacy program. We piloted that at CB Dunbar in Bond County. It was very effective, and now we're going to take that to other counties as well. So that was a great pilot. So she's decreased our drug stock out rate from 90%. We didn't have enough medication, to 10%. I think that's admirable. So increased accountability of medication, national task force have been established, no reports of missing medicines and health supplies. So we're doing audits as well. Right now, we're tracking the immunization registry. We're tracking children under 2. So we have real-time data on that as well. So you can go to the next slide. Thank you. Okay, so I talked about this already. Increased remuneration of 5,675 health workers. There's it right there. We moved over 500 staff from volunteers onto the payroll. So as far as workforce development, we're training some scrub nurses, radiographer, and nurse anesthetists. That's right at TNIMA. We have new residency training programs in radiology and anesthesiology, enhanced special training for the Ministry of Health staff in other countries. We have some nurses, and we have some nurses actually right now in Kenya. I actually went on that visit with the ministry. We have nurses at Amref Hospital, Amref University,
programs in radiology and
in Nairobi, Kenya, and also Gertrude Pediatric Hospital. We went and visited, and nurses being trained. We also have nurses being trained to be dialysis staff. So real-time, hands-on, actual account of training being done. So on the regulatory body, the Liberian Medical Dental Council, Nursing and Midwifery Board, Pharmacy, tracking and prosecuting fixed service providers, as well as unregistered facilities. So you actually have the ministers going into those facilities and her team as well. Because we do have some challenges. Everything is not going to be changed right away. We've had a fragile healthcare system since the Civil War. So it's taking some time, and we'll talk about partnering with the diaspora as well. So registered non-debarred facilities providing services. The malaria vaccine was in 2024. 6 counties right there was treated. Vaccination coverage from May 2024 through August 2025, 45%. That's great. We have a reduction in malaria and HIV rates decreasing. Next slide, please. So we are increasing our health infrastructure, primary and secondary health facilities. We have 80% completion of 150-bed maternal and pediatric hospital, the new Redemption. I also work as a labor and delivery nurse when I do bedside nursing. Increased community engagement towards inclusive community drug revolving fund, and procurement of MRI. We showed that in the video, the MRI machine at JFK. As the minister with some of her staff and partner. Next slide, please. So rebranding the healthcare sector under the leadership of Dr. Butto. This is my visit to MREF. This is some of the nurses. So the guy in purple sweater is a staff. That's me with a bag hanging on my arm. World Bank Rep, Dr. Tia Saki Mo, Dr. Balon, the Deputy Minister of Administration, Martha Morris is right there, and some of the nurses that are being trained. So plans for our future, we're opening a midwifery school in Bumi to serve the Western Cluster. So that is Bumi, Grand Cape Mount, and Bapulu counties. We're also opening a dental training institute. We're increasing the capacity of biomedical technicians to handle new equipment, because that's been one of our challenges. We get equipment and we don't have biomedical engineers to work on those. And so when they spoil or there's an issue, we can't use the equipment anymore. So that's a good thing. Construction of additional regional diagnostic center in Bumi to serve the Western Cluster. Establishing a mobile surgical outreach team to deliver services at hard-to-reach communities, and construction of a staffing house for the healthcare workers. We actually toured some of those facilities, and they really needed to be updated, bring it up to standard for people to live in. Okay, so collaboration with the diaspora. We want to increase the participation of the diaspora in the Liberian health system. So right here, one of the things we talk about is for the doctors and surgeons, physicians, surgeons, nurses. What the minister is hoping to partner with you on is on your sabbatical. When you're moving, when you go to Liberia on those extended times, we have some attrition in the rural areas. We're hoping that you can partner with the Ministry of Health when you're in Liberia and go into the rural areas and work, do those surgeries, see those patients. And it's not voluntary, you will be compensated. So want to harness untapped potential to mobilize and increase health investments, capacity building, I just talked about that. Formalize a diaspora health partnership framework under the Ministry of Health. We're going to call it the Diaspora Health Desk. And potential outcome, we're going to increase special training and exchange program. I know that there is some group that currently go to Liberia. We're hoping that this can be through the Ministry of Health so that it's cohesive, that we all work together. Continuous professional development program. Temporary skilled professionals will be hired. Improve the digital health records, telemedicine, and innovative technologies. I talked that we're looking at our own EHR, electronic health record system, and improving public-private partnership to increase diaspora-led business in the health sector. That's me. Minister Cheo, the Deputy Minister of Policy and Planning, and Minister Boto. So I just talked about the health desk at the Ministry of Health, which would serve as like a help desk. So everything you want should come through the Diaspora Health Desk. So that, we're not going around trying to figure out, okay, how do we get in touch with the minister? Because the minister is over 5.4 plus million people. So can you go right back to that slide for just 1 second? Okay, sorry. All right. So exploring partnership models and agreement options for a win-win collaboration. Okay, so we're thinking that this is going to be a flagship because I know that some of this has been a challenge. Next slide, please. And since Dr. Poto is not here, there is a panel coming up. So I'm going to skip the question and discussion for the panel. Okay? And thank you so much.
Thank you very much, Madam Kearney. So, a great essayist and critic, Great Britain, once said, "Your body is the only place you have to live, so take care of it." Health is wealth. Health is power. There are a lot of local vendors out there who supported this event. We encourage you to visit them, purchase what you can to help support them. Dwalu has a very important message, and we'll keep Dwalu in the queue. For now, ladies and gentlemen, we want to welcome 2 minutes remark because of time. The International Organization for Migration, Regional Director for West and Central Africa, Madame Sylvia Ekra.
Good afternoon, Your Excellency, Mr. President of the Republic of Liberia, and Madam First Lady, honorable ministers, Your Excellency, the Ambassador of Liberia to the US, distinguished chairs of the Liberia Diaspora Annual Conference, the head of the Office of Diaspora Affairs in Liberia, other esteemed officials from the government of Liberia, my colleagues from the UN and UNDP, and beautiful members of the Liberian diaspora here present. It is a profound honor for me to speak before you today, not only as the IOM Regional Director for West and Central Africa, but also as a daughter of the diaspora myself. I left my country when I was 2, I grew up across several countries, and I hold 2 nationalities. So I carry within me the experience of always having been a little bit here and a little bit there. So it is really with particular respect that I salute and pay tribute to all members of the vibrant Liberian diaspora who have answered the call and are present in this room today. And I absolutely love the energy in this room today. In addition to my personal experience, the very first assignment that I was entrusted with 23 years ago when I joined IOM as a young professional was precisely on mobilizing the diaspora for the development of the African continent. So this is my first area of expertise. And since then, nothing has replaced the deep conviction that I carry that diasporas are forces for transformation. And that is why I commend the government of Liberia for this remarkable initiative, for the vision that this forum embodies, and for placing it under the highest authority of this nation. It is a strong and long-awaited signal that resonates fully with the ambition of building a prosperous and inclusive Liberia. Thank you so much, Mr. President. The fact that the new National Development Plan, the Arrest Agenda for Inclusive Development, places the Liberian diaspora at the center of its implementation as both stakeholders and financing partners provides a powerful foundation that lends weight and continuity to the commitments that will emerge from this forum. And the chosen theme, healing, reconciliation, and rebuilding a new chapter for Liberia, is equally profound. And here I want to say something. Many of you may not know that IOM has been facilitating the transportation of all the Liberian refugees that have resettled to the US, to Canada, and to Europe after the crisis. All. And I met at least one yesterday, and I know that there are many of them in this room, and I'm particularly moved to think about the journey that the country has traveled since then. Really, it is remarkable. Excellencies, ladies and gentlemen, I would like to share 4 key messages. I was given 2 minutes, but I have traveled from Dakar, and I have to share those convictions with you. And these are really deep convictions that were shaped both by my personal journey, but also by more than 20 years of professional experience on these issues. So first, we are at a turning point. For years now, remittances have surpassed official development assistance. And at a time when traditional aid is declining, diaspora contributions appears as one of the most powerful and consistent levers for national progress. In 2024, diaspora across West and Central Africa have transferred $35 billion US. And the Liberian diaspora alone, the same year in 2024, sent $800 million US in remittances. And that represents almost 17% of the national GDP of Liberia. You can clap for yourself. So this conference is therefore a crucial opportunity to reflect collectively on how to transform this potential into a sustainable engine for inclusive growth. Second conviction, we are not starting from scratch. This effort builds on a foundation that is diaspora-driven, national, regional, and continental, and I'm going to explain why. First, from the diaspora perspective, we are building on a Liberian community in the United States, in Canada, in Australia, in Europe, in Africa, that is large, that is organized, and that is deeply rooted with long-standing achievements both at home and abroad. So we are standing on the shoulders of these achievements. From the national perspective, I have already mentioned the central place of the diaspora in the Arrest agenda. But most recently, on August 6th of this year, the government of Liberia, with the active support of IOM, launched the Diaspora Engagement Task Force at the Executive Mansion in Monrovia. And this Diaspora Engagement Task Force that is led by the Office of Diaspora Affairs, and I want to salute and give kudos to the indefatigable head of the Diaspora Affairs Office. They are coordinated through the Minister of State for Presidential Affairs and the Minister of Foreign Affairs, the task force to institutionalize diaspora engagement as a core pillar of national development. Now, at the regional level, Liberia is part of a rising wave of recognition that the diaspora is central to our collective prosperity. Last July, Mali convened its first forum. I was there in Bamako. 2 weeks ago, the Prime Minister of Senegal launched the diaspora bonds for Senegal in Milan, in Turin. In Milan, in Italy. They will organize their diaspora forum in December. And Mauritania is going to organize their diaspora forum in November. So the entire region is seizing this opportunity, and Liberia is showing the way. And at the continental level, the African Union's Agenda 2063 places the diaspora at the heart of Africa's aspiration for development and transformation, and they have formally recognized the diaspora as the 6th region of Africa at the African Union. So consider yourselves not only as proud Liberian diaspora, but also as part of a rising African diaspora that is taking its rightful place. So everywhere, good practices are emerging. Nigeria, for example, has successfully harnessed the momentum of its diaspora through specific bonds, and the Minister for Finance was talking about bonds this morning, mobilizing millions of dollars to strengthen their foreign exchange reserves. These are the kind of things that we can do with your remittances. So Liberia, by gathering this forum today, is not acting in isolation. It is feeding into a regional momentum, and it is helping shape an emerging vision that diasporas are not peripheral actors, but they are central architects of Africa's prosperity. Third conviction that I want to share, the impact is real, but it can be multiplied. We know the transformative effect of diaspora investment and skills transfers. They feed, they provide access to health and education, they create businesses, they build homes, and they stabilize our youth. We've been talking about creating jobs. This is how we don't see our young people embarking on perilous journey on the Mediterranean Sea to try and reach Europe. And across the continent, we are seeing clinics, agricultural cooperatives, and schools come to life thanks to diaspora commitment. But we need to embed these dynamics for the long term and at the necessary scale. And this is what your ministers have been saying. We need to move away, although we need it and we respect it, and it's important to build human capital. We need to move away from the small transfers that are sent to households to investments, productive investments at scale. And for that, we need the financial institutions at the table. We need the African Development Bank, we need the World Bank, we need the regional banks, the public and the private investors. EcoBank was here. They all have a role to play because the potential is immense. But to fully unlock this, we need strong alliances, collective frameworks and partnerships that match our ambitions. And we are counting on Liberia to be driving some of those alliances. Fourth, and my last point, is that our ambition must be a long-term relationship of trust with the diaspora. Too often, the diaspora is treated as an abstraction. Yet, behind every remittance is a person, a story, and very often a sacrifice. And for this reason, whatever the circumstances, diasporas will continue to contribute. They're not waiting for us. Especially when families and communities are in hardship, the diaspora has always been there. But this contribution should not be taken for granted, nor left without recognition. And this forum is a first step in that direction. And really, it's heartwarming to see. So we have to continue to design policies where support flows in both directions. We must listen, and we've been listening really intently for the past 2 days. We must protect. You were asking for consulates yesterday. We must equip and honor the diaspora. We must offer services, financial products and rights, not as an exchange, but as recognition. Recognition that members of the Liberian diaspora are partners, co-authors of this new chapter, and not just remitters. The next step is to turn individual commitments into collective vehicles that build jobs, skills, and growth. And because the diaspora is diverse, we must design instruments that reflect the diversity of this diaspora. It has to make sense across social classes. We are not just talking to the elite. It has to make sense for women. It has to make sense for the youth. It has to make sense for second generation and third generation. I have seen some kids in the room here. Excellencies, ladies and gentlemen, let me conclude with this thought. A new chapter is not a new cover on an old book. It is new pages written together. And I think that's what we are doing here with this forum. This is the moment for change. Here is where new momentum can be born. And it is together that we can lay the foundation. And at IOM, we have been supported more than 100 member states in doing the same thing that you are doing here. We have the tools to support your ambition and your journey. For example, our diaspora mapping guide with a proven methodology to map diaspora communities where they live is something that we are putting at your disposal. Most recently, we completed a detailed mapping of the Ivorian nationals in 2 French cities, and a similar exercise is being planned for the Liberian diaspora in the United States and in Canada. So, Excellencies, ladies and gentlemen, healing begins when the future feels possible. Together, we can create a framework where the diaspora is not on the margins, but at the very center of Liberia's future. The journey ahead will be demanding. It's not going to be easy. The path may be hard. But let me leave you with one quote from Howard Schultz, who is the founder of Starbucks. He said, "When you are surrounded by people who share a passionate commitment around a common purpose, anything is possible." So, united in resolve, we, as your partner IOM, can shape a new chapter for this beloved country of yours. And it will be our honor to stand beside you as you do so. I thank you very much.
What a powerful 2 minutes delivery. Congratulations for making such a wise use of that time. 2 minutes, so short. Regional Director Sylvia Ekra, the significance of the diaspora have cascaded into several headings since yesterday. Firstly, the diaspora have been considered as a major partner in the development of our country. The rousing presentation by Erasmus Williams, who's commonly known as the president of the diaspora. Then the demographic statistics by Dr. Al Hassan Conte. And then the pledges of support from the President Pro Tem, the Honorable Minister of Finance, Honorable Minister of Agriculture, and the display by the LRA boss. All these things have shown to us in the diaspora that although we are significant, but we are part of a collaborative team, that Liberia cannot succeed without us, and we cannot succeed without Liberia. We are nothing without Liberia shining. The onus is upon us to stop all the talk. We've talked a long time. I'm about to introduce somebody very important who supported our effort. And that person should have been introduced by the veteran Charles Russell, who decided to decline and allow me to shine, just as Madam Magdala Cooper did yesterday. So thank you very much, Mr. Russell. I'm now welcoming to this podium the country director of the United Nations Development Program, Republic of Liberia, Mr. Aliu Dia. Thank you.
Thank you so much. Bonsoir. Your Excellency, Mr. President, Madam First Lady, Honorable Pro Tem, members of the legislative branch, honorable government officials. Mr. President, it's really, for me, very difficult to say something meaningful after your brilliant speech of yesterday. It was inspiring, very inspiring for all of us who were in the room. And what to say after my sister from OIM has spoken so eloquently. So I will try just to say a few words, Mr. President. For us at the UN in general, in Liberia, speaking also on behalf of our resident coordinator, Madam Christine Omutuni, who couldn't make it, this is a privilege for us to be here. Mr. President, I, as UNDP, did not want to fund an event like this. What we funded is your call to action. And that, for us, is very important. So Sylvia has talked about why you guys matter as the diaspora. But I will challenge you. And those who listen to me in Monrovia, in Liberia, they know I'll always want to challenge in my speeches. So I'm here to challenge you, the diaspora, the Liberian diaspora, to challenge all of us. Sylvia has talked about it. Every year, Liberians abroad send close to $1 billion to Liberia. This keeps families afloat. It pays tuitions and support households. We know that, and that's what you have been doing. But let's be honest here. Remittances alone cannot transform our economy in Liberia. Because we're not using them to build power grids. We're not using them to build industrial parks in Liberia, and we need them. We are not using our remittances to build hospitals. The Minister of Health has just shared something here on health. So, if the diaspora limits itself to consumption support, then Liberia will remain stuck in survival mode. Right? We agree to that. Okay, so let's use our remittances not only for survival mode, which is good, by the way, but we want to transform our country. Right? So, if diaspora channels even a fraction of those resources into productive investment, Liberia will leap forward. Because, as Sylvia has said, other countries are already doing it. The Nigerian diaspora is mobilizing almost 20 billion annually. 20 billion annually. And much of it is fueling now banks. The money is going into banks. The money in Nigeria is going into fintechs. The money in Nigeria is going to real estate and so on. Ethiopia, if you've been walking around, you've seen the Ethiopian diaspora here in Washington. The Ethiopian diaspora has been heavily investing into Ethiopian airline. The Ethiopian diaspora has almost funded or financed the Ethiopian dam that has been inaugurated weeks ago. You take the Ghana is almost the same into agribusiness and SMEs. And now Ghana, we know, is one of the Africa's most attractive investment destination. And that, the Ghanaian diaspora has played a critical role into that. So the question is, why not Liberia? We can do it. So I want us to commit for that, and we will do it. Of course, the Liberian diaspora has already done some amazing work. Those things that I've said, it's not like nothing has been done. You guys have done amazing work into using your remittances also to support development. If you take medical care, the diaspora professionals help establish, as far as I was told, I'm quite new in Liberia, the diaspora has helped establish the Jackson F. Doe Memorial Hospital. In education, you have been building schools, entrepreneurship, SMEs, and so on. Because these are important, but as far as I know, they remain fragmented and at small scale. We need to be bold. The Minister of Finance always challenged us in Monrovia by telling us as development partners, you have to dream big. You need to be bold because the government is bold. The president has ambition for the country. So if you're not being bold, if you're not being, dreaming big, then we won't be achieve big things. So that's why I said they are small in scale. Imagine what could happen if these efforts were pulled into a diaspora development fund of 200 to 300 million to do something meaningful for the country. Imagine if capital was directed not only to housing, but also to renewable energy, to agro-processing, to digital startups, and to industrial zones. We are now talking about development of Liberia. So I believe, Mr. President, that the diaspora engagement must evolve. It must evolve from charity to strategy. It must evolve from nostalgia to innovation. And it must evolve from sympathy to investment. So that means pulling capital into structured investment vehicles to finance infrastructure, climate smart agriculture, the Minister of Agriculture has talked about it, and to finance technology. Nothing will happen if we are not into the technology in Liberia. We can use technology to leapfrog, but we need investment. And that's why UNDP a few months ago has agreed to sponsor the very first, under the vision of His Excellency Mr. President, the Liberia Tech Summit. The very first one. And that summit was a groundbreaking event. So the Liberia digital technological ecosystem is vibrant, but we need to bring those people together and then start moving forward into technology and digital. So that's what I think many people have talked about. Investing in growth sectors. I talked about agribusiness value chains. The minister has talked about it very clearly this morning. The digital economy. UNDP with the University of Liberia will be starting in the coming months the very first master program on artificial intelligence, cybersecurity, and digital transformation in Liberia, because what we want is for the Liberians to harness and to be trained and to be experts on artificial intelligence without flying out to go to other schools, other universities. And we are starting that in the coming months. So I appeal to you, whoever you know in the diaspora who is engaged into artificial intelligence, cybersecurity, digital transformation, please send that person to us so that we can bring him to Liberia to help. So, great, so we're gonna catch up. So UNDP is working in a lot of other areas. I won't come to them because I think because of time. I'm just gonna be challenging you by closing these remarks, just asking you one question. And please, you have to reflect on that. So do you want to be proud Liberians abroad? Yes? Okay, great. Or will you want to become bold Liberians investing at home? Either one of them. Of course, we are all proud to be out there. I'm a Liberian, yes, good. But I am a bold Liberian investing back home. That's what I prefer, right? Good. So, will you be content to build homes in Monrovia? I know most of you are building nice houses in Monrovia, or will you be building factories, energy systems for our communities in Lofa, in Nimba, in Grand Jide, in Bomi, Grand Cape Mount, in Maryland, or are we going to build houses, or are we going to build the universities? A university that will carry Liberia forward in the future. Will you be sending money for today's needs only? Or will you plant investments that yield jobs, innovation, and prosperity for tomorrow? Will you be remembered as a diaspora that loved Liberia from a distance, or as a generation that rebuilt Liberia with your hands, with your minds, and with your capital? So I believe that the opportunity is now.